Now, here's George Roberts.
Joining me now on the program is Joe Pinto. Joe is Chief Operating Officer here at Lehigh Valley Hospital, Pocono in East Stroudsburg. Also understand, Joe, that it will encompass Dixon City and also the new facility that's being built in Tannersville, which we're going to talk about in a little bit. But welcome to the program.
Thank you so much, George. I'm happy to be here and excited as it gets to be here in the Monroe County and happy to be in this community.
Let's talk a little bit about where you've come from. Former president of the Lehigh Valley Hospital, Hecktown Oaks, which is in Lower Nazareth Township in Northampton County. And I understand you have 25 years of healthcare leadership experience. You previously worked with St. Luke's University Health Network in Carbon County, which many people may know you from there. Also with Sacred Heart Hospitals, and some people might not know that you went to the University of Scranton and also Moravian University. So I know I just encapsulated that really fast, but maybe you can tell us a little bit about yourself growing up first in South Philly.
Yes, George. I grew up in South Philadelphia, born and raised, and migrated my way here to the Lehigh Valley through football. I played football in high school and was recruited by Moravian College at the time, and never really heard of the Lehigh Valley, to be honest, back then in the high school days, but fell in love with the valley and all it had to offer. And the school, obviously, was an amazing program and a great school and gave me an incredible undergraduate education. And then from there, I stayed. And as you said, was at had a wonderful career at St. Luke's. They gave me my start, and forever grateful. But most recently, thanks to my wife, I'm here at Lehigh Valley, and they have given me an incredible opportunity as well over at the Hecktown Oaks campus, as you said, in Lower Nazareth Township. And I for the last year and a half, have developed amazing relationships with that community. And just been so thrilled to be part of this great organization. And now here I am in Monroe County with another outstanding opportunity to help lead with this incredible team around me, the Lehigh Valley Pocono campus and our surrounding region.
So you're learning more about the area, the Poconos, and what's your first impressions here of the hospital in the area?
I say this a lot, and it's only been 6 weeks that I'm here, but it feels like a lot longer than that. And that's because of the community. I mean, the community has just been incredibly welcoming. And I mean the surrounding community, our community in our campus here. I'm just blown away by the culture. From the moment I walked in the door and met Tiffany, our front desk person, just such an amazing, bubbly, welcoming, friendly personality. And that's carried through every single interaction I've had. Our nursing team, our physicians, and all the support team that I've encountered. Just an incredibly warm and welcoming environment. So I'm so blessed and privileged to literally to be here and working among such talented individuals.
Nice. What can you tell us? I'm sure you've talked with the staff here and administration, and what can we tell the community about what you're thinking about for like long-term goals here that you would like to achieve?
This hospital and this community is so blessed to have such an incredible service. We're really, we should be very proud of what we have in this community, and that's provided by Lehigh Valley Hospital. We are literally a full-service hospital right here, Monroe County. It starts with trauma. So we have a level 3 trauma program. What does that mean? So that means that we can take care of the sickest patients right here. God forbid somebody's in an accident or should have, a fall. We can take care of those patients right here.
So you don't have to ship them out.
You don't have to ship them out.
Okay.
Yes, they could stay right here. We have all the technologies. We have all the talented physicians right here, from open heart surgery through all the other, major general surgery, plastic surgery, whatever that may entail.
So when you came in here, you came into a full running hospital.
I did. I'm very lucky here, George. Very lucky. The community is the one that really benefit. from having that. We also have labor and delivery. So we're the only hospital in the area that delivers babies. And we're making a significant investment in our we're building a brand new labor and delivery unit. The construction is literally underway across the street from where we're sitting right now. And I think the community is going to be really, really excited about what we're building there. And then Open Heart is just another one of those areas that make us unique and full service. We have a full cardiac program inclusive of open heart surgery that we provide right here, again, close to home.
When people think about the travel distances to get to somewhere, I mean, having this hospital in this community in the Poconos, at this point, like you said, there's nothing else like it. The distance between here and the Lehigh Valley, for example, to go. And people here don't want to travel that far sometimes.
No, it's true. And I travel. I do right now live in the Valley. So it takes me 46 minutes, literally door to door. And, I'm thankfully healthy. And, it is taxing. But so imagine somebody that's sick or a family member that needs to travel for care. Being close to home and reducing transfers. I mean, it's proven to improve outcomes when you could stay closer to home. The care is right here. So I'm really happy about that and proud to say that, we can offer that service here at Lehigh Valley Pocono.
So let's talk about healthcare trends. What's going on in the industry? What should our viewers know about? Maybe there's something up and coming. We all hear about telemedicine. I know people that, especially younger people, they are not afraid of using apps on their phones and talking to a doctor, maybe over an app and things like that. But even the simplest thing of like setting up an appointment, you can now do over the internet and things like that. I mean, that has really changed a lot of things for people. But is there anything else that you could tell us about healthcare trends?
So part of our mission, George, and it's a great question, and where are we going, so to speak? So our hospital, again, completely wired as far as all the latest and greatest in healthcare technologies, including, as you mentioned, telemedicine and virtual care. So if there's, and we have most of the consultative services right here in our hospital. But there are some that we need to tap into our Cedar Crest or larger institutions. And we can do that right from the luxury of the patient's room. So we have the capabilities of bringing those real specialties, right to the patient bedside. Part of our mission as an organization is to prevent disease and promote wellness. So we've invested significantly in this community throughout Monroe County, where we have health centers, we have labs, and with the idea that folks can access care really close to home. We're trying to remove any barriers that may exist, and they do exist out there, George, where patients may need to get that lab to check cholesterol levels or to check sugar levels, A1Cs. So we want to make sure people are doing everything they can in our community to help prevent those diseases and stay on top of their health. So we try to do everything we can to provide those access points, again, throughout the community where folks make it easy to access those services. You also mentioned mobile health, so to speak, and apps. So I have a 19-year-old daughter who's attending the University of Tampa. So I'm very, she's doing wonderfully and very blessed and lucky to be down there. But everything's done over the phone, as you mentioned. So LVHN has apps through our Express Care, through My LVHN, where they can access that care conveniently, literally right on their phones. So there should be, if somebody gets sick, they can access, our Express Care services virtually, and to make it, again, very easy and very convenient.
I know as we get older, we tend to need more healthcare services. I'm not saying that everybody doesn't need it, and should be, get checkups and things like that, but even as you get older, you tend to have to go to more doctor's visits and things like that. So it is nice to have a place close to home. especially when you're older. You don't want to be driving that far. And I know scattered throughout the Poconos, you have a lot of different offices and things from Mount Pocono, Tobyhanna area, all the way down here to Stroudsburg and East Stroudsburg area. So I guess you're in charge of all that, right?
Yes, I'm me along with a lot of talented individuals, and again, who I have the privilege to work with every day. Our leadership team is incredible, and it takes, as they say, it takes a village, and we have an incredible village right behind us here at LVHN to provide all those services. One that you mentioned over in the Bartonsville area is our brand new hospital.
Right.
That's coming online this January. So we're building a brand new hospital there, as well as a medical office building to, again, even as I said, to make access to healthcare even more accessible, so to speak, and easy.
What should people know about that hospital? I'm sure they're curious as to, we know what this hospital is here at East Stroudsburg. What's the one in Tannersville gonna encompass there?
The best way I can describe it is it's as I mentioned, this is full service hospital with all of those services. This one is almost like a sister hospital to us, where they'll have an emergency room for the sickest patients. They'll have inpatient beds and all of the supportive radiology services and so forth that go along with having a hospital and providing the top level care. But if somebody should need a higher level of care, we have built-in pathways and mechanisms to get that patient, from not too far away, right over to our hospital here at Pocono.
Let's talk a little bit about screenings, testings. You have all that available, and people really should take advantage of that because so many people feel, I think, out of sight, out of mind. If I don't know about it, maybe it's not happening. But the truth is, I think the sooner you can get things taken care of, the maybe less invasive it might be, better for your health, right? Those kind of things are really important. And of course, that is all offered here through Lehigh Valley Hospital Pocono.
It is, George. I'm guilty, as you mentioned. I had, I'm at that age now where I should be having my screenings, and I did. I had my first colonoscopy last year, and through LVHN, and it was not as bad as everybody had kind of had heard. And to answer your question, yes, we provide all those services right here. It's again, with the latest technologies, so easy to access right through your phone, or pick up the phone and call or go online. There's so many different venues or areas to be able to do that. And as I mentioned, not just here at our hospital, but throughout the community. I had my colonoscopy, not far from where I live through LVHN. So there's so many different access points. We try to remove, as I mentioned, any barrier that may be out there. But what I found is the same type of culture through my own experience that I found when I walked through the doors of Pocono. Again, that warmth, that empathy, that easy to navigate, and just a great experience overall. They really put me at ease. I think I was more fearful of the unknown and what to expect. Where they walked me through, this is what you're going to expect every step of the way, and I really appreciated that as the patient. And that's what I expect of our team here, and I've seen it firsthand.
I think many people do have that fear, and that keeps them away from doing a lot of things medically because they just don't know and aren't sure. What I found over time is, and I hate to say it, but the more you go in for testing and things, the more you get to understand how it's done, it becomes routine. And it now becomes like more of a part of your life, which I really think healthcare should be. But a lot of times people are afraid, and it's the fear of unknown, as you said.
It really is. And again, we try to do as best we can as an organization at LVHN, as I mentioned earlier, to promote wellness, disease prevention. We want the community to be out there. We're going to be out there. I know me personally, I've made that commitment to be out as much as possible in the community, meeting with folks like yourself and the surrounding businesses and EMS communities and so forth and so on. Our schools, had the pleasure of meeting our school leaderships both at the university levels or high school levels. So I'm looking forward to partnering with them to promote wellness, make sure that we remove any barriers and make healthcare more easy to access.
Joe, Lehigh Valley Hospital Pocono has been here a long time. Early 1900s, this was built. It's been in the community forever. And it's gone through many different phases. It's been a smaller hospital. It's been bigger. It's been built up. And now we have what we have here with the cancer center and everything. It's a quality facility. And I think that maybe people in the community sometimes don't realize that. And they think, oh, I've got to go someplace else. I've got to go farther away to get quality. But the reality is quality is here.
You're right, George. Quality is right here in our backyard. I'll give you an example. I mean, there's a company out there called the Leapfrog Group that measures safety and quality inside of hospitals. And there's a grade, just like we were in high school, A through F. And we're an A. We have a top level performance right here at LVHN Pocono. And there's other measures as well that we look at on a daily basis that, prove that we are a extremely quality organization. You mentioned our cancer center. We're sitting in this beautiful cancer center right now. We have a full array of services, all accredited. Same way with our trauma program. I mentioned, one of the highest level trauma programs in the country, who receive accreditation. Open heart programs, our labor and delivery. They have all our orthopedic program, top rated in the country as well. So when you pull it all together, you're right. Quality is I'm so proud of the clinical quality that we do here. And that's why we're all here.
Sure.
Is our number one mission.
Something you work at every day. I mean, it's not just, hey, we got these accreditations or we got the certificates and we're all good. It continues. It's a continual thing. And people may say, well, it's just a money business. People are trying to make money. Well, it takes money to run this, operations like this. It's not easy to do that, And so I think it's important that people understand that it's an everyday thing that you're involved with and the staff here is involved with. It's not just, oh, we did it. We're good for now,
Oh, you're so right. I mean, it literally is a everyday focus for all of us. Sure. Not just myself, all of our leaders, all of our staff members, and even our ancillary staff. We're all, constantly improving and constantly focused on our patients and quality, as well as experience. Experience is really important for us too, and we score really well in our surveys. We survey every patient that comes through our door, and we do extremely well in our surveys for inpatient as well as our emergency room. That's another area where every day we're just striving to get better in our clinical quality as well as our patient experience, which is also, again, very important for us.
Now, the community has some questions about Jefferson Health and how that plays into what Lehigh Valley Hospital does. Maybe you could just kind of give us an idea of the, how this is all working and where it's all going with Jefferson Health.
Yeah, we're beyond, as excited as I am about being here at Lehigh Valley Pocono. We're equally excited about this whole, Lehigh Valley and Jefferson coming together. And I think, we're still working through a lot of the integration, going extremely well. But, when I boil it down, I think it's the easiest way to describe this is it's more resources. So, as you have a larger organization that comes together, and Jefferson, again, one of the tops in the country, Lehigh Valley, one of the tops in the country. Now we have, this big conglomerate of resources. What do I mean by resources? Physician resources, nursing resources, technology resources, even a health plan resource, where we talk about improving the lives of our community. That's how we're going to do it. We're going to bring these resources all together to provide services or at least access to services that we never were able to do as a smaller organization. Now that we're larger, we're going to be, training the next or the future generation of nurses, of technicians, you name it, that will be able to have that pool of great, amazing talent to bring to Monroe County and the surrounding areas and region. With the Jefferson integration, another big benefit is going to be our health plan. So I think it'll be another benefit for the community. But I just want to remind folks that you're always going to have the doctors that you've had forever here at Pocono and have grown to love and got to know. They'll always be here for you, and they're not going anywhere. So, when I say more resources, it's in addition to, the great docs and surgeons and team that we've had here and providers that we've had for, as you said, decades. So happy to report that, and just happy about where we're heading for the future. It's very bright. So I just wanted to say thank you for welcoming me and for supporting our great hospital here. If anybody has any questions, please don't be a stranger. We're just proud to keep healthcare close to home, and we'll continue to do that for years and years to come.
Jill, thank you for being with us. Appreciate it.
Thank you. Thanks, George.